So I'm probably unique in that I actually don't have a iTero scanner in the particular office that I'm working, is that we want to integrate that technology. I own 6 practices in and around Lexington, Kentucky, and one of our practices is already using an iTero scanner. So therefore, it's kind of become a little bit of a competitive thing. And one of the huge benefits that we see doing in our practice is we do a lot of Invisalign cases. And so we know that that's going to, the difference in taking wet impressions and actually using wet impressions as opposed to using an iTero is a big difference for us. In fact, right now I'm sending a lot of my patients to the other practice to be scanned so that they can get the scan, because often we don't capture the proper impression in a wet impression. So just the speed, the efficiency, it's a significant difference for us. So that's one big reason that I want to bring it to the practice where I'm working, because I don't like it that the other practice has the iTero and I don't. And the other reason is from a diagnostic capability. In our hygiene, it's a big deal. I really want to move into the 21st century. I think in 2020, everybody should be doing a digital record. I think it's significant for each patient to have a digital record. I think it's almost like standard of care at this point, so that we can actually refer back and understand and actually be able to educate a patient as to what they see. And the technology in the 5D is significant for that, and to be able to just really teach and educate a patient right there in the chair by scanning them.